Hi everyone, I'm Becky Needham and I work at RoSPA as a Road Safety and Evaluation Officer. I'm really pleased to have been given the opportunity to speak as part of the Fringe programme for this year's Road Safety Festival. In my short presentation, I'd like to speak about some research that we at RoSPA have conducted on Joint Strategic Needs Assessments, also known as JSNAs, and the impact that they have had on the delivery of local road safety programmes. As we all know, working together can produce great things. There are obvious links between road safety and public health, and that means that there is lots of potential for road safety and public health practitioners to work closely together. The idea of partnership working isn't new. Many public health professionals have an interest in road safety, and road safety partnerships often include representatives from public health backgrounds. An opportunity for closer working came along when local authorities took over control of public health in 2013. Local authorities were then required to produce a JSNA. In March 2014, we surveyed local authorities to identify the number of JSNAs that included road safety. It was found that around half of them did, although the content and style varied greatly from full sections to single paragraphs. At the time, JSNAs were widely seen by road safety practitioners as an ideal opportunity, as this would allow road safety managers to incorporate their road safety activities and policies into the wider public health agenda. 5 years on, in 2019, we decided to revisit this and try to understand what progress had been made in integrating road safety and public health activities. The aim of our research was to explore whether road safety was integrated into local JSNAs and to what extent this was the case. We also wanted to understand how involved road safety practitioners feel in developing their local authority's JSNA and what impact this has had on the delivery of local road safety programmes. To assess the current levels of integration between road safety and public health teams, and to identify any joint work as a result of the JSNA since 2014, we conducted an online survey with road safety practitioners. This survey ran between July and November 2019. We promoted the survey in a number of ways, such as via our social media channels and through our contacts at RSGB and ModeShift, who helped us out by sending out our survey to their members. To help us gain a more in-depth understanding of how road safety professionals felt about JSNAs and the extent to which this had impacted on the delivery of local road safety interventions, we also conducted a group interview with 2 road safety professionals in October 2019. Our research produced a number of key findings, which I would like to talk through now. Our first finding was that around half of those who took part in the survey reported that their organisation had a road safety section included in their JSNA, which is similar to the findings of the 2014 research. Just over a quarter of those who responded said that their JSNA didn't have a road safety section, and the other 27% were unaware of this. Those who took part in the group interview were also asked if their JSNA had a road safety section. One of the professionals stated that although they had been asked about statistics for road safety and trends by their public health colleagues, road safety didn't seem to actually have been included in the final version of the document. The other road safety professional who took part in the group interview said that their JSNA had a section called Transportation, and this covered sustainable travel and road safety statistics for the area. The amount of road safety content included in the JSNA also varied for those who responded to our survey. Of those that said their JSNA had a road safety section, 80% said that this content could be described as incorporated into a bigger section. 20% described the content as a small standalone section. Our second finding was that, disappointingly, JSNAs have provided very limited funding opportunities to road safety teams. Our survey showed that 73% of JSNAs did not provide capital or revenue financial support for road safety teams. The remaining 27% of those who completed the survey were unsure whether it had provided funding for their team. One of those who had attended the group interview had not received capital or revenue funding as a result of the JSNA. However, they did feel that there had been lots of positive discussions between the road safety team and public health professionals, and the road safety team had been referenced in a number of public consultation documents. They had also indirectly received some money for a school travel related project, and this was for them to contribute towards running costs, although the money was actually awarded to the organisation working alongside them rather than the road safety team itself. The other road safety professional who attended said that their team had been awarded some funding for a 2-year project, but the funding had stopped partway through that project. Our third key finding was that sadly, in many cases, JSNAs have had little to no impact on the delivery of local road safety initiatives. 73% of those who completed our survey said that the JSNA had had no impact on the delivery of local road safety programmes. Despite this, 18% felt that it had had a positive impact on the delivery of their programmes, but 9% felt that it had a negative impact. Both of the road safety professionals who attended the group interview felt that the Joint Strategic Needs Assessment had made no impact on the delivery of road safety in their area. Although one of the practitioners was fairly involved in developing the needs assessment, they did not feel that this had had any impact on their work. Several of those who completed the survey also stated that although the JSNA had started with great intentions, activities such as quarterly meetings had tailed off, and this was often because key members of staff had moved posts. One of the practitioners who attended the group interview said that although the Joint Strategic Needs Assessment had brought the teams closer together initially, this had stopped and there had now started to be more focus on other health issues such as pregnancy and drugs. Some professionals also felt that it did not lead to a meaningful road safety strategy, and that often the JSNA resulted in extra work but created very little returns. However, some practitioners did have a positive opinion of the JSNA and were taking a proactive approach to ensure that their road safety section was included within the JSNA. Our final finding was that over half of those surveyed were somewhat or much less involved in developing the organisation's JSNA than they had been 5 years ago. The survey revealed that just 9% of respondents were somewhat more involved in developing the JSNA for their organisation. 27% were as involved as they had been 5 years ago, and 63% were somewhat or much less involved. Despite the fact that JSNAs have not necessarily led to more joint working, funding, or had an impact on road safety programmes overall, some really excellent examples of joint working have still been identified. An example of a programme resulting from the JSNA is Walsall Council's A-STARS programme. A-STARS is a whole school approach to active sustainable travel and road safety. The programme is a series of walking, cycling, scooting and road safety initiatives, along with training, expertise and support that is given to schools to help them to promote and develop safer, healthier lifestyle choices for all. The A-STARS programme requires schools to register, commit to the compulsory core elements of road safety and active travel, and they then select from a range of healthy lifestyle initiatives. Each school that takes part registers to the programme, selects a champion or coordinator, and produces an annual action plan. This action plan is underpinned by the results of the school's annual travel survey. These are reviewed annually. The coordinator is assisted by a small group of pupils, which are known as A-STARS sheriffs. This is to help with the implementation of a variety of sustainable travel and road safety initiatives contained in their action plan. These initiatives work with the whole school, parents and the wider community towards increasing physical activity, providing training opportunities, creating a safer, cleaner environment and reducing dependency on car use. As a result of the programme, in 2018, over 2,400 reception-age pupils and their parents had received practical pedestrian training. 1,800 Year 3 pupils had received pedestrian training, and over 1,250 children had been trained to Level 2 or Level 3 standard bikeability. There was also engagement with parents. As a result of the programme, over 20,000 parents and carers were engaged with through school gate parking campaigns. Parents were also engaged with regarding child car seats and were encouraged to use the 5-minute walking zones outside schools with their children. All parents of both preschool and transition-age children were also communicated with prior to starting full-time education or transitioning to the next school. The programme also achieved a 1% decrease in car usage and a 7% increase in active travel, which includes walking and cycling compared to the year before. In summary, our research has found that overall, although there are some examples of positive joint working, such as the A-STARS programme, there is still much that can be done to increase the levels of joint working between road safety and public health professionals. If you'd like to read the full report, it's free to download from the RoSPA website. Thank you for listening.